but he was kind of done with me after 2 to 3 years because he had said, well, there's nothing left to do except put him on IV chelation. And
welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, a doctorate in OT, specializing in neurology, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hello and welcome to another episode of Autism Uprooted podcast series with BioNexus Health. I'm Dr. Jodie Dashore, and today we have with us a wonderful mom from right here in New Jersey. Melissa is going to talk to us about her son Michael was diagnosed with autism spectrum disorder when he was little. And I've known Melissa, I've had the privilege of knowing Melissa and her family for many years. Michael is completely neurotypical now, and he was neurotypical a few years ago. And then, he had an episode of, an inadvertent episode of seizures because as Melissa will explain, his daily maintenance program was derailed a little bit, and then there was excessive electromagnetic frequencies, EMF exposure, and he went into seizures. But we were able to reevaluate, look at toxins and infections, and bring his body back into balance, so much so that his EEG was normal, and he's been taken off the seizure medication, all of the associated fatigue of someone, all of the associated symptoms of someone who is a seizure patient, with epilepsy. Those symptoms are long gone. He's in high school now. He is happy. He's thriving. Immune system is nice and strong. So without further ado, I would like to proceed, and let's welcome Melissa to the show.
thank you for having me.
So let's get started.
Okay.
And, we've known each other for a while.
A long time.
Yes.
Probably like 11 years now at this point.
Right? Yeah, exactly.
I think Michael was like 5 or 6.
Yes. And Brian was like, 8 or 9.
Yeah. Mm-hmm.
When right. So I was in the throes of everything, right? Trying to get rid of the diagnosis, dealing with all the comorbid infections. Mm-hmm. And I was still seeing clients, and Michael was one of them. Amazing. Yeah. So can you tell us, how did you hear about options for children diagnosed on the spectrum?
When Michael was diagnosed when he was 3, and he started in early. We had started with early intervention. Maybe he was 2.5, and then we were able to get transferred into the preschool in my district, and my early intervention therapist stayed with us, and she had experience with other biomedical treatments, or I don't want to say treatments, but just therapies that people would use with kids on the spectrum. And I didn't know anything about really autism at that point, nor did I know anything about anything biomedical. So she would give me little tidbits, and then I would go just on the internet and research little things. So I came across the TACA website, and that's where I originally found any biomedical information And I didn't even know this existed because your regular doctors don't tell you anything about this. So once you kind of dive into that area, you're kind of on your own to find anyone who can help you with that. And there's, and unfortunately, there's really no providers in the insurance network, so they don't really know about this stuff. And so I found a doctor locally here in Monmouth County, and he was an MD, and he ran some odd tests on my blood work on Michael that I didn't know why he was running them until later on. And he found that Michael had very high levels of strep in his body. And I didn't particularly know what that means, but I knew my son at 3.5 or 4 had been on antibiotics for ear infections at least 4 to 6 times a year. And at that point, I was actually making an appointment down at CHOP for an ENT eval.
Okay, CHOP as in Children's Hospital of Philadelphia, which is a local large hospital.
And I did so this doctor, he ran multiple blood items. Also, he ran a Lyme test at the time, not an in-depth Lyme test, just whatever you would do at your normal LabCorp. And there was a strand or 2 at the time where he was positive. And he also ran tests for yeast, and which again, I didn't know what it meant. And at that point, I was grasping for straws. So I kind of was in his camp, and he put him on antibiotics for probably a month or so with the strep, if not more, and an antifungal for the candida and the yeast, and multiple supplements to, as he would say, clean out his gut. And he explained the whole leaky gut situation, and kind of went over my head a little bit, but whatever I could do, because my son was so little at the time, I would attempt to do. There wasn't any swallowing of pills because he was so little. So whatever powders, and he gave me probiotics that you could sprinkle on food, and whatever little vitamins I could get into him at the time, I would. And we were doing clay baths at the time, also he recommended. And within, I would say, 2 to biggest change with Michael at the time was his coloring.
Melissa, wait. You froze for a second. So can you go back to within? You were saying within, and then you froze.
Okay. Within 3 to 4 months, I would say, of those treatments, the biggest change was his coloring. Michael was, his skin was almost translucent. It was this white-ish gray color when he was little. Not when he was little. It must have been in between when he was born, and then got whatever secondary infections he had, because he was a peachy baby, up until he was like 1. And when this doctor started to treat him for these items, his coloring completely changed. It looked like what your coloring should look like. His veins were popping out. He wasn't this like whitey gray color that he had. So he like pinked up again. And when we redid the blood work, every couple months, you saw the strep numbers coming down. They never went away completely, but they were down. The Lyme panel, I don't even know if he redid, so that's on me. But we continued with him for probably 2 years. And you could tell whatever he ate. It was, I think they also did a little bit of a vitamin panel, and that he wasn't absorbing all the nutrients because of the leaky gut. And and he was a good eater. So at that point still, you could tell that something was different about the way he looked. At that point, he was still volatile if he didn't want to do something, or if it was a non-preferred activity, he could still be volatile. But the point. And then my OT retired, and Michael was 5 or 6, and I was looking for new ones, and I went to one and I didn't like her, and then I found you, and we started just doing strict OT work with Michael. At that time, you were just doing the usual puzzles and all of the floor work with Michael.
I recall, yes, we were just, sorry, we were just doing regular sensory integration therapy with him at that point.
And I found you out of a book. Like, it wasn't, it was by chance. And the other doctor at one point had given me some information on autonomic nerve system. And I was just too overwhelmed at the time. I didn't even look at it. And my therapist was like, I don't know what this is. And I can't. At first, it's funny, she thought it was kind of like hokey. Until now. And she, until we both researched it together, and she's like, wow, this is kind of spot on, Michael. And then you were working with Michael. It had to probably be for about a year. And you said, I know we're unstable there. Better? Are we good?
It's looking, suddenly your screen, your screen just got small, then it got back. Okay. All right, go ahead.
So we were with you for about a year, and I gave you Michael's blood work, and you saw all these high levels. People thought they were better. And then you introduced the biofeedback, which again, I knew nothing about, but if you thought it was, a good idea, we had been together for a while, and it was always you and I doing things with Brian and Michael.
Right.
And I was always a couple of years behind you, and I could never do things as thoroughly as you did, but I saw Brian and saw what you were doing. So I would always say, all right, well, we can give it a shot. So then we started with the biofeedback, and within a month or two, Michael's 5 or 6, and he spoke.
Wait.
And he spoke.
Wait, Melissa, this one is huge. Wait, I'm just going to stop this.
So we started with the biofeedback, and within 2 to 3 months, we saw a remarkable improvement in his verbal language. He always had language after he was 3 or 4, but it was, he would get extremely frustrated when he couldn't express something, which I didn't know at the time why he was doing it. But and within a couple of months of doing the biofeedback, my therapist was, she knew what we were doing, but she kind of not forgot, but just she's like, I see such a verbal difference in him. It was kind of like a switch was put on, and he was able to talk, like he would have conversations with you then at this point. So we continued that. I don't know, I guess you have to remind me how long we continued that. But we did it a while. And then you must have seen his blood work. And then you introduced the herbal
Herbals.
antibiotics, because I had him on, it was at least 2 rounds of a long-term, month to, once or twice a year, putting him on a regular antibiotic. I don't remember which one. And then you had you had said to me, well, these numbers are still high. And as we know, Michael still goes to the pediatrician, and he's 16, and his strep numbers are fine because we fixed that, but he has other infections that nobody considers infections anymore because they're not active, and they are not concerned that his numbers are off the charts with these numbers. And so when you explained to me how the blood work works and you said, well, we can do this a different way. It's going to take a long time, but these drops, which they look foreign, they're these little bottles, and I had no idea what they were. But you said this will help him and this will work, but it's not, it's not a 5-day thing. It could be, I think it took years. I don't remember, but it took definitely a couple of years and a couple of different herbal antibiotics that you changed over. There were 2 or 3 that were always there, and then you would add a few things in, and you started to see the difference again, just more language, a little. And as the time went on in that year or 2, I'm not going to say calm because he wasn't at that point yet, but much more tolerance of outside offenders, whether it be a person, a food, a temperature, anything. He could handle things a little bit better than he used to be. Everything was always 25%, 25% better, 25% better every time we did something. And after that, then you and I talked, and you explained then the concept of foreign bodies in him, whether it be bugs, parasites, again, things you don't know exist until you're in this area. And then everybody would explain to me, we all have these things, but his body, for whatever reason, is different. Probably everybody in your house has these in their body, but you can all detoxify them, and they don't bother your stomach, and they don't bother your brain. And so then we attacked those with some more herbal remedies, and there was something else you might have done with the parasites, but there was definitely that parazoum thingy, and the throat spray, and the whole, and again, then you saw more verbal interaction and less anger. As every treatment we did, the anger levels came down, again, 20-25% every time. I don't remember if we did any blood testing for parasites or anything, but again, I only needed some blood type proof. If things were working with you, I never really needed scientific proof because I saw it with him.
The changes you saw
were happening. So I knew it had to be something. He was getting more social at the time, but again, the anger came down exponentially with those 2 treatments. And then I guess I don't even know how we got the prescription for blood work at that point, because then you must have sent me to check out the Epstein-Barr and the herpes 6
Yeah.
and the line, we did a bigger line panel at the time. And then you were treating for those. And again, then, you know, we got to the point, I think he was in 5th grade. So I was with you a while and I thought everything was all good. And kind of, my daughter was older and busy, and Michael was actually getting busy. You know, he played a sport at the time. He was out and about and in school and had made up friends. And I thought we were kind of, and he was still getting behavior therapy because she stayed with us a very long time, probably till he was in middle school, and probably more for me than for Michael, because she kept him in check. And he would still have episodes up until maybe 5th grade. And once he got to middle school, he wouldn't have behavior issues around the house at all anymore at that point. In school, there was still very mouthy issues that sometimes if somebody, even a teacher, if somebody was not doing what he wanted or was attacked, he felt attacked. Michael's whole life, if he felt attacked, that's when he would go on the offensive and not act socially appropriate. And that would still continue in middle school, but they also knew me very well. We live in a very small district, and we had worked together for so long that they were very good to Michael. And if he did things that probably another kid would have done, they might have acted differently with him. So we would, but they knew if they called me, I'd call the behaviorist in. She worked at school, and we would make a plan.
Right.
And as long as they told me what it was, and my behaviorist is a genius, and we would all just get together, or she, even at that point in middle school, she would do it. And I would stay out of it. I would know about it, but she would just say, I'm going to do this, this, and this with the teacher and Michael. And she would talk to everybody. And, we always would tell them, if you let us know, we'll fix it, or we'll try to fix it. When you let it go too far, or you try to handle it yourselves, it won't work. And took them a while in middle school because they're not used to dealing with it as much. But once they figured it out, and once they figured how to work with him and know that he just had to make one phone call and we'll do this. So with all those big changes that I had seen, he appeared to be a neurotypical child as you were going to see. Okay. Compared to what he was when he was 2. And I kind of left you.
Question, if I may. So actually, more than a question, I'll just summarize first, and then what we've heard so far, and then I have a question for you. So you started on the biomedical path with Michael, with a Dan doctor. And you found a strep and possibly Lyme. Strep was treated. You saw his color change. He looked healthier. Then you heard about sensory integration, and you decided to start with BioNexus for sensory integration in the beginning. Then, slowly, as I started learning more with my son, I started to share with you as well. And we started doing biofeedback for Michael, right? Biofeedback, bioresonance therapy. It helps with the underlying toxins and underlying infections. And we actually started to see Michael, or you saw, and I did as well, his language exploded. He started expressing himself much better. His behavior therapist noticed, you noticed that, and I did, of course. His conversations got more mature. more age appropriate.
Yeah.
And then, right. And in school, he was starting to make friends. So we were seeing cognitive improvements. His immune system improved, his gut improved, right? Ear infections,
Yes.
all of those were things of the past. We started treating Lyme disease and co-infections. Here, I would like to mention, we ran some labs which would be urine testing. Sometimes the pediatricians will cooperate and understand. So we were able to get some blood work going with him, and we saw lots of infections. And you're absolutely right, Melissa, because this is something that I had learned with Brian. I had learned from Dr. Jones, Dr. Trifoletti, that because Lyme disease, mycoplasma, co-infections, they suppress the immune system, you don't always see IgM positives. You will see what looks like extremely high IgG numbers. So it looks like, it's a past infection. But if it was really a past infection, why would the numbers be so insanely high in the labs? So that was the experience. I had noticed a huge amount of benefit for Brian upon treating these chronic infections with herbal antibiotics. So that's what we did for Michael. And again, right, at this point, you're saying we saw exponential progress as his immune system started feeling better because these infections were gone. It took a couple of years. Right.
And it's a slow process, but you don't
Yes.
mind the slow process.
Yes.
You saw how well he was doing and a very big difference. And I don't think without, nobody points you in this direction. I just stumbled upon all of this. And like I said, back in the day when they had the Dan doctors, it was a very big, this is 13 years ago. Well, yeah, it was a big part of a portion of the autism community. And then there was the portion that thought it was quackery, that they didn't believe in any of it. And it's, and I think you had to weed through that.
Right.
Personally, because I know I have a friend or two who jumped in and did everything known to man, and it didn't help. And then you have, it depends on your personality, I think, as well, and how much you can take and what your family situation's like. I had another child. I could not do everything these people would put on their website and wanted you to do. And I couldn't get in the supplements that they wanted you to take. And I was lucky because he responded to probably a third or a half of what was recommended to me by that camp back then. But it's really more of a eye-opening experience that it exists, because you would never know these things exist. So even if you didn't like your Dan doctor or didn't want to do what they said, or, I broke with him at a point, and that's what made your treatments more reasonable, because he wanted to chelate Michael. And that's when I left him. It was 2 to 3 years. And I think now, thinking back, he was the one who wrote the scripts for Michael's
lab work, for the lab work.
Yes.
Yeah,
when I started, I was still with him, and he was the one, because he understood the concept a little bit. He was only really in one little camp, but he didn't say no to me. But he was kind of done with me after 2 to 3 years, because he had said, well, there's nothing left to do except put him on IV chelation and detoxify him that way. And from the head cells, and I
remember that. Yeah.
I was at the point where I had seen such an improvement in Michael. I wasn't I didn't, and I'm not much of a researcher, and that's why I have my people, and they do it for me, and it was kind of like, yeah, this seems a little too out of the box for me. Like, I was just happy with the improvements that we made, and if that's the way I had to live with my child, I could handle that compared to what it was 2 to 3 years ago. He could talk, he could walk, he could go to school and not hit anybody really at that point. All that, but
Yes.
so
So
I
wait,
made that decision that I wasn't gonna put that in his body. And then you introduced, then, like I said, it was for me, it was all fate and where I landed.
yeah, with me. So, yes, I've heard that from many parents that they don't really wish to do anything invasive, intravenous therapy, intravenous chelation, IVIG type therapy for pandas. And another thing that is very striking, what you mentioned, is that you did the best you could with the old, what it used to be called as the DAN protocol. Nowadays, it's called as the MAPS protocol. And if you were not willing to go forward with more invasive techniques, you were kind of, let go at that point, and then
There was nowhere
nowhere else to
done.
go.
And
Right.
maybe I would have found it again with my people. They probably might have found it for me.
Right.
No, you were done at that point because there was really nothing left. They would have just said, you've been on the antibiotics, you've done this, you've done that.
Right.
The only way to get rid of these things in his body is to put this in him. And
Right. Right.
luckily you were, like I said, for me, it was all just fate, and everybody landed to me at the right time.
Yes. And then you were mentioning that by fifth grade, he started doing well. He was more or less neurotypical at that point, doing well in school, making friends. You guys were handling minor behavior problems with your behaviorist. And then you and I said goodbye at that point, right? We put him on a small maintenance program, and we said, he's doing well, so let's
And
see what happens.
I kind of dropped the ball because I thought we were good. And,
Okay.
Little did I know, 3 years later, I was coming back to you because he had a seizure, and I, ended up in the hospital, and it was, he had a neurologist come into the hospital. Luckily, they kept him and did testing right there. And the neurologist was adamant that he needed medication, and which I didn't have a problem with because I'm not anti-medication. And if you're telling me my kid is going to have more seizures, well, at that juncture, you're going on medication, because I couldn't watch what happened again. And so then once he got home, and we did about a month of the medication, and he was just exhausted after the 3 weeks after the seizure, and he was getting used to the medication. And then I called you back and said, gave you the situation, and you said, okay, we need everything tested. And well, people don't want to do that, and I completely understand the financial burden of it, because it is a lot. And I would wish for anyone that there is some way to do this that is affordable. But it is very expensive and very pricey. And but I wanted to make sure that there was something else not going on.
Right. No stone left unturned.
And, a bit of my own fault, because I did leave you, and whatever maintenance we did, I stopped, I just thought we were done. And
Right.
that's my own my own, I'm not going to say fault, but like I said, you see your kid and he's playing on soccer teams and he's with other kids and he's
But he
absolutely
was, yeah,
fine. So
he
you
was
think,
doing great. He was
and
doing
you
so
think
well.
all is fine. And your pediatrician, oh my God, everybody sees him who knew him. Well, yeah, and everybody is amazed. And it doesn't look like Michael when he was 4 or 5. And so you kind of just say, all right, his outside is fine. His insides must be fine. But then, you have an episode like this, which in a way, thank God he did, because I would never have thought to come back to you. Um, and really, and what I would say is in between the time when I left you and he had the seizure, he was a very tired and fatigued boy. Um, and we just thought, because he was lazy and we thought he was fragile. And we just, again, it didn't dawn on me to do vitamin testing at the time, because that is stuff you could have done on your own. You didn't need, if I would have said to my pediatrician, I want to run a nutritional panel or vitamin, she would have done it. She's pretty good that way. That wouldn't have dawned on me. And then you and I got back together after the event. And we said, you're like, you basically have to start from scratch and see, you needed data. So we got you data. I was lucky enough to find someone at the time who was in my insurance plan and did run a lot of testing on him. And I think I actually went to her before I went to you again. And she ran an entire panel of nutritional testing, regular blood work, and then I'm like, I guess it's time to call you again and see, and have you at least read the blood, even if I wasn't if there was nothing, I wanted you to read the blood work and see what a regular doctor wouldn't see in numbers. And then you said, I think you need to redo the infection testing. And my suggestion to you would be is to do the whole Great Plains panels. And at that point, again, because you're desperate, I say yes. And luckily I said yes, because everything that was there was stuff that he had that just wasn't it was never gone. And it looked like on the outside it was gone, but his insides were still not right. So you bring to you can't even mention any of this to the neurologist because he thinks you're crazy. I think I might have mentioned one sentence about him being on the spectrum as a kid and having Lyme disease, and he thinks you're absolutely off base. So not to overlap and mention some things that you might be doing or not. You don't want to hide stuff, but they don't, Michael presented to the neuro as neurotypical, as there was nothing like, he didn't even, they kind of look at you and don't believe that, he was on the spectrum at the time. So with those findings, then you and I started a regimen again to get rid of all the co-infections you know me for a long time, and I wasn't ready to go at it as hard as you wanted to, because I didn't know where we were at with the seizures, and if I didn't want to, even though they're natural, he was on medication, and I didn't want to. I was happy going at it slowly, but to the point of financials,
Oh yes, of course.
it taking me much longer, and it costs much more to do it this way. So if you can stomach it a little, the way you wanted to do it, it would have been better. But I just couldn't, and I knew what I could handle, and I didn't want to throw too much on myself or him. So we, went through the blood work with you and all the Great Plains numbers, which you didn't like, because they all led to the road of, which I did not, you and I probably never talked about it, or if we did, I just poo-pooed you, of neurotoxicity in the brain. And that's where we started our new journey in 2019. And while I'm not a researcher, I do what you guys tell me to the most part, but that's where you learn about how these infections and toxins blow up his brain. And literally, they probably blew up his brain, added with 10 hours of video games a day. But so that was where our new course took you and I, and your explanations of how these are so rooted in his body because he's had them for so long, that for somebody like Michael, or maybe anybody else, it can take years and years and years to get rid of.
Yes. It pretty much depends on how long you've had it in you. It's going to take that long to detox you from those. So I believe we found lots of toxicity, mold toxins, mycotoxins, as well as additional industrial toxins found from herbicides, pesticides, glyphosate. So what I had asked you to run was a full panel to look at what kind of neurological toxicity could be happening in his brain, which is causing the seizures for him. Children on the spectrum who've been on the spectrum prior, then became neurotypical, they still seem to have that tendency, especially if there was PANDAS type issues, to go into seizures if the EMF protection isn't put into place. Like you mentioned, many hours of screen time every day. And it's not just blank screen time, right? It's it's a lot of visual overstimulation, which can interact with the inflammation in the brain. And yes, many MAPS doctors, DAN doctors are not fully aware of underlying mold, mycotoxins, Lyme disease, additional co-infections, toxins. And many are not even aware that there is a completely natural, fully plant-based herbal remedies, medicines, which can be used to handle this. So we did everything we could for Michael again, right? A couple of years ago. And, it doesn't take many years. It takes a couple of years to have the child, or, young man now in a good place. So what improvements did you see? Were you able to get off the seizure medications? You mentioned he was tired. What improvements did you see?
So from, like I said, maybe all through middle school. So I think, again, between attributing it to him being a little lazy and us thinking he was this fragile boy, and he would come home from school and sleep. He would he couldn't, his physical, like, he always had that low tone thing going on from when you saw him as a boy, and even as other therapists. I mean, it was terrible. He would flop, like his limbs were just very floppy, and he couldn't walk around the block without being exhausted. And we really did. My daughter is very active and could go all day long, and we could never understand how they were that different. And while I might not be the most active person, my husband's he exercises a lot and is fairly active. And we couldn't understand how, and then we were maybe attributing to a hormonal like he did kind of go through hormonal changes earlier than maybe in 7th or 8th grade. Definitely by 8th grade, he was definitely a hormonal component, I think, to the seizure probably too. And but it was just like, he's just like, it's just so odd. He's so and he could never tolerate the heat. He couldn't. It was just I don't know. We could never really understand how he was this way. And once he had the seizure and he was on medication, and we started with you, within, I would say, he was still sleeping. He would come home, and I think that seizure and the medication took a good 4 months to really get out of him and get him used to the medication. But that was, so he had the seizure December. By like that summer, June and July, you could see him have this energy like that he never had, never, ever was able to, like he would go on a run. He would never run. He could stay out and play basketball for 2 hours. He used to go out for 10 or 15 minutes and then, I'm tired, I want to come in, or, and we would go to the beach. He always liked the beach, but we would go to the beach. He would always get, after an hour or two, and it wasn't bored. He would just be like, you could tell he was hot and tired and just not, we went to the beach that summer. He could stay 3 or 4 hours and then stay home and not be laid out on the couch for the rest of the day. So there were just a whole physical change about him. He had this endurance now that he never had, and he was not as sleepy as he was during the day. And he was always a good sleeper at night, so I can never complain. He always slept his 8 to 12 hours. So that was never a problem for him, because I know a lot of kids on the spectrum don't sleep. That even when he was younger, that was not a problem for him. But this change in energy, and there was just, the fatigue was kind of gone. And again, you can't, there's only one thing you can attribute that to, is attacking all the infections that were in his body. And since you and I left each other from 5th grade until 8th grade, you became more involved in the mold aspect of it, because you and I had never spoken about that back then. Whether we never got to it, whether it wasn't in your wheelhouse then and you were just starting it. It wasn't in the forefront then. And now you've learned so much more about it, and sometimes the testing just doesn't lie, because I'm sure there are some people out there that are like, there's mold, like, so what, like, and but in his body, whatever the testing does, it doesn't lie. And whatever changes he'll be going into 11th grade, and we're due for another big round of testing. And so I guess we can reconvene in December and let you know what happened. But, we saw numbers come down in every category. Again, not as fast as you would have probably liked with the infections, because they were still hanging out there. Last time we did blood work 6 months ago or a year ago, they didn't budge as much as you wanted. At least the Epstein-Barr didn't. The other ones, they came down. But then with that other further testing you did, and it doesn't lie. So I guess it's the people maybe where the blood work comes and it's marginal, and maybe they would have to be the ones that explain to more as to why it might be beneficial. But with Michael, it was right there on paper. And again, it's testing no one would have ever thought to do. And some of it wasn't really that, I know it's specific, but the inflammation test, I don't know, I kind of feel like they should do that on everybody.
Shouldn't they? I know, I agree with you. It's actually from what I recall, yes, all of Michael's numbers started to come down. Now, some strong viruses like Epstein-Barr, they tend to linger for a while, especially kids who've been on the spectrum. As the immune system is getting modulated, kids with PANS, we cannot boost the immune system because then you're boosting the autoimmunity as well. So you have to slowly work on the immune system, and they have their whole lives ahead of them. And Michael has grown. His puberty went well. He's tall. He's strong now. He's got good endurance. He's neurotypical. He's in a regular high school. He's getting decent grades, and he's not doing seizure medication anymore.
No, we just
He's been fine.
We started weaning him in January. He's been off since April. We were just at the doctor a month ago, and they did just the office EEG, and it looks good right now. As any neurologist will tell you, we don't know what's going to happen. We don't know why it even happened. But as of now, he's off, and unless there's another episode, they'll tell you for 6 months.
Right.
It's when maybe we'll see it. So if you get through the 6 months, then maybe it was just situational and things that happen. But again, you talk to somebody like you, there is a reason, and again, your neurologist will never believe you that there is a reason, because that's not their thing, which is fine. He's there to treat. He's there to look at it that they're testing and see the brainwaves, and he treats to that, which you have to respect. But that doesn't mean, there might be another reason.
Yes, that's true. That's interesting to me as well, because like you mentioned, Michael's EEG became normal. I've had I've had other patients whose EEGs became normal, whose pulmonary scans, diagnosed with sarcoidosis, the scans got better, brain MRIs, started to look better, and all they did was herbal medicine. And recently I had one little girl on the spectrum. Her mom and dad also were, kind enough to do the podcast like you are. And they mentioned that, her surgeons at Stanford, she had to have an important surgical procedure, which she couldn't because she was having medical issues, which prevented the surgery from happening. And both loads of antibiotics were not fixing that until, they stopped that. And we fixed her gut, and we started her on herbal medicine. Her labs became fantastic. And they finally went in for that important surgical procedure. And the surgeons at Stanford looked me up. That was interesting. And they said, they acknowledged that the herbal protocols is what really contributed. So off and on, you will have a few open-minded, conventional allopathic surgeons, physicians who will acknowledge, but on the on an average, they don't because they don't know.
They don't know, and I think it's hard for in my humble opinion, a scientist who has gone through medical school and they're taught one way. And I guess it's got to be difficult if you have somebody coming in there who's wants to fight with them and do it in one way and not their way. But my hope is that at some point there is a combination for everyone, because again, in my humble opinion, there are, I'm sure, things out there that you need conventional medicine for, and conventional medicines. So, but if you have some sort of combination, and those are the doctors you rarely find that might say, okay, you want to try this, I'll let you do this, then we'll try it, but then it's got to be my way after 6 months, or we can combine something. There's no, they don't, you find a rare doctor who will, look towards an herbal treatment,
Option.
or even such a thing as a chiropractor, an acupuncturist. They don't think that they have any really benefit to people. And I mean, I'll take Michael to the chiropractor. It's the best thing that ever happened to him. And my chiropractor is a little bit different. He does a lot of homeopathy and stuff, but you see even just a difference in he knows when he has to go. So he knows if he hasn't been adjusted in 3 to 4 to 5 weeks, which is, sometimes again, I get busy and, and he'll feel it like, Mom, I have to go. Okay. And if you gave that kid acupuncture, he'd probably love it because he buys into all the treatments, and he knows what makes him feel better. He's at a young age found what makes his body feel better. And he will tell you, he doesn't know why he feels better, but something feels better. He will tell you that.
Tell you, right?
He can't say what it is, but he knows that there's some kind of difference. So,
Yes.
Maybe in 10 years you can interview him.
Yes. Yes, we were helped by chiropractors and as well as acupuncture therapists as well on our journey. Absolutely. So we shall find out at the next round of labs for Michael to see, how much further his level of toxicity and infections have reduced. But he's doing well. He's doing really well with sports and studying, and he must be enjoying his summer off now. So I won't keep you any longer. So
well, this was great. Thank you very much for having me. It's nice to rehash Michael's journey, and maybe it'll help someone else along the way. Now you know so much more than you even did
back then.
Yeah, you have so many more so much more expertise now than when we started, so you can help a lot of people.
Well, thank you for being here today. It's been a privilege working with Michael and yourself all these years.
You too. Thank you very much. All right, take care.
Take care. With Autism Uprooted, thank you for joining us. I hope it was helpful to all of those watching. I look forward to seeing you at our next episode. Take care. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.